How's it going, guys? Difficult question, MSK anatomy for the different steps. Our correct answer is patellofemoral pain syndrome. I'm going to tell you exactly what you need to know for the exam so you don't fuck this up. You ready? You're going to get a 10-line massive paragraph about knee pain. You have no idea what's going on. They're going to tell you that some dude has pain in the knee that's worse when sitting for long periods of time and or when going up and down stairs. Answer, patellofemoral syndrome, aka patellofemoral pain syndrome, aka chondromalacia patellae. They're all the same thing. They're used interchangeably in USMLE and in clinical practice. Patellofemoral syndrome is technically a broad umbrella term that refers to the pain constellation I just gave you. Sitting for a long period of time, let's say in the car, going up and down stairs. That's patellofemoral syndrome. Chondromalacia patellae is technically a structural degeneration of the cartilage in the knee, hence the name, that causes patellofemoral syndrome. It's one cause, okay? But they're used interchangeably. So obesity and powerlifting is risk factor. Powerlifting, your knees think you're overweight, right? So that's what we have here. We have sitting for a long period of time, pain going up and down stairs. That's the pain here. So patellofemoral pain syndrome. Let's chop out the others. Osgood-Schlatter is wrong. The pain would be more inferior. So it's below the level of the knee. So at the tibial tuberosity, it's at the superior shin. So it's going to be a 14 to 16-year-old kid, fast growing, plays soccer. So the patellar tendon inserts onto the tibial tuberosity. You get microavulsions in fast growing kids. And you get apophysitis, which is inflammation at the tubercle of the tibial tuberosity. So, but the pain's more inferior, and it's not going to present with this as we have here. Patellar tendonitis, the pain will be above the level of Osgood-Schlatter, but below the level of patellofemoral pain syndrome and chondromalacia patellae. In other words, we said Osgood-Schlatter is at the level of the tibial tuberosity below the knee, and patellar tendonitis, aka patellar tendinopathy, aka jumper's knee, never would have guessed it. Pain that's worse when playing basketball, volleyball, jumping. But the pain is above the level of tibial tuberosity on the patellar tendon, but below the level of the kneecap / patella itself. Okay, and you're not going to have pain when sitting for long periods of time or when going up and down stairs. It'll be more described as pain that's worse when playing basketball, volleyball. You understand? So let's chop out the final ones here. So patellar tendon rupture is wrong. That would be sudden pain. Okay, and they'll tell you that the patient can't extend the knee. You get a high riding patella called patella alta. If you want to be real fucking sophisticated, they can tell you on physical exam that there's a gap palpated in the patellar tendon. Wrong fucking answer. Choice C, Passan serine bursitis, fucking wrong. That's going to be infromedial knee pain. Okay, so obesity can be a risk factor for that, but pain in the infromedial knee, so bursa, the fluid sacs that help protect the joints, sometimes you just get idiopathic inflammation there. But if someone says, oh, I've got pain like kind of below the knee in the toward the midline, so infromedial knee, you're like, yeah, it's probably just Passan serine bursitis, and it usually just goes away on its own. Wrong fucking answer. You know the deal. On 2 minute more content on the subscription channel. Appreciate your time. That's it.